I'm Dr. Weiss. I'm the Chairman of Physical Medicine and Rehabilitation here at Nassau University Medical Center. We treat patients here who have had an injury or an accident and can't function as well as they used to. So it could be a stroke, could be a spinal cord injury, it could be a motor vehicle accident, could be an amputation, but it's something that's limiting them from going home, from living a full life. So we want to give that back to them. We want to give them their life back. And it takes a very, very dedicated team of professionals to do that. We have a fabulous staff here. We have psychologists, speech therapists, physical therapists, occupational therapists, recreational therapists, nurses who are specialized in rehabilitation, a full team of physicians, and all of us work together to try to improve the function of the patients, again, so that they can return home. We just underwent a $2 million renovation of our unit. It's beautiful. We have a 25-bed inpatient acute rehab unit. We treat patients after an injury, an accident, a stroke. Our goal for all patients is the same thing. We want to get people back to going home, being with their family, doing the things that they did before they became ill. Well, rehabilitation starts on admission, and the patient is encouraged to do as much for themselves as possible. They'll be evaluated by the entire team, the physical therapist, the occupational therapist, the speech pathologist, the neuropsychologist, the rehab nurses, the recreational therapists. Everybody gets together. We meet on the patients regularly to say where the patient is doing better, where we need to kick it up a notch, and the patient is, again, the most vital part of that team. So if somebody has had a stroke and maybe they can't use one side of their body, they still need to cook, they still need to make the bed, they still need to do the laundry. Well, we want to simulate an environment as close to what the person will be going home to as possible. We have a community re-entry room where patients can practice the skills that they're going to need at home. For example, grocery shopping, going to the bank. We have a kitchen set up so that they can practice cooking in a safe environment, a bedroom set up. Our staff members can help them say, you know, you need to use this equipment, maybe we can recommend you do this a little bit differently, so that when they return home, they can be as safe as possible, as functional as possible. There's nothing better than seeing the patient leave on that final day, if they've been here for 2 weeks or 3 weeks, get out of bed, walk to the elevator. They usually give us and the therapists and the nurses and the staff a hug or a kiss goodbye, and we know that they're better off, that they're going home, that they're going back to their loved ones. They're going to be able to enjoy life, and we had a part in it. It's very fulfilling.